Hey guys, so today we are going to talk about dealing with the angry patient. So there are certain protocols like spike protocol, the ECG that we use in the explanation or for talking to the patient who has undergone an unexpected outcome. Like in this scenario which I have given you, um, in that a woman is bleeding from last 1 month after the normal vaginal birth, and the GP has given her courses of antibiotics, and she has been seen after 1 month, came to the hospital, and then evacuation of the retained products has been done. While doing the evacuation, the perforation has happened, and then laparotomy she has undergone, and colorectal surgeons were involved, and so that's quite, like, she was not expecting that. So in this scenario she's quite unhappy that why, what have you done? Can I become a mother with my uterus, womb inside, or like these kind of questions she's asking. And like, I came for just the evacuation, and why the big bandage is there? Have you removed my womb? So you have to follow this case in some particular steps. Like, first you have to show the empathy, that's E, and then you have to quietly listen to her, whatever complaints or whatever bout of anger she is having. That you have to listen, and you have to show non-verbal expressions as well, and verbal also. If you can nod your head or just keep on saying that I can see that that's a stressful thing, and I'm sorry that this complication has happened to you. Like once or twice you can say sorry. And then the clinical part, then you have to come to the clinical part, and in this clinical part you have to tell her what was the course of action or course of the events that has happened, right? Like, she was taken for this, and now, but before starting, before you start, you tell her that, what do you ask her about her knowledge, that what does she knows about her situation. Has somebody spoken to you in the ward, or has someone told you that what has happened before me? Do you know anything? Okay, so let me explain it to you, um, in the way the things have happened and why the things have been done this way. I would like to try my best in explaining, yeah? And then G is governance. So ECG, empathic, clinical findings you have to tell, and then governance issues you have to sort out. So just tell the patient that, assure her that whatever has happened, we internal inquiry will be made or will be set up, and you will also be informed about whatever we have done, or if there will be any one who is at fault, that will be told to you as well, and the proper actions will always be taken by the NHS. And we do these inquiries for improving our own practices. And again, you can say anything else. And apart from that, in the end clinical part, what you will be telling her, that she'll be saying, yeah, why have you done this? And do you have any answer that why I have this big bandage on my tummy? Then you have to just make her relaxed and tell her that, sorry that this complication has happened to you. I would like to explain you the sequence of events in a way it has happened. But before that, may I know that has anybody spoken to you in advance or before me? Do you have any idea? Okay, Mrs. XYZ, as you rightly said that you came for the evacuation of the the cleanup from the womb, but because the most common cause of bleeding, we offer you that if in ultrasound the products have been seen, because sometime after normal birth or after any delivery, afterbirths may remain inside in a small bit of cases, when they are too sticky or not coming out completely. and over the time some infection may come up, and that's why GP has given you a course of antibiotics as well. So here you are, explaining the GP thing also. If she asks you, don't give unnecessary information, but if she asks you, you have to explain her. And then the planning of removal of those bits have been taken. Well, unfortunately, because of normal delivery, and because of the pregnancy and the delivery, and apart from that, the infection thing which is set up inside the womb becomes very soft, and while doing the procedure, my colleague had doubts that womb have given way. So, for your best of the safety, and as you were, because she will ask you, why did not you ask me before opening up my tummy? Then you say, because you were under the effect of anesthetic drug. So, in your best interest, my colleague consulted the bowel or gut surgeon instantly, and we, informed the anesthetist and took the decision of opening up the tummy and seeing it whether there is any injury to the gut, because gut is in close proximity to the womb. So to just to be doubly sure, that was opened. And once we opened that, the gut surgeon or bowel surgeon saw that there is no apparent injury to the bowel, but just a superficial injuries were there, which have been sewed over and taken care of, and it's not going to give you much botheration. Just after a few days you'll be you'll be overcoming that. And apart from that, the womb, it was having slight bleeding on the top. There was a perforation or a rent over the top of the womb, so that has also been sewed over by my colleague. And all senior doctors and best of the team was there who was taking care of you at that time, so that in future you should not have much of the concern because of this. So now and then just take frequent pauses as well, and in between this, so that if she want to ask anything, she'll ask you. So now so your womb is very well within your tummy, lower tummy. We have not removed it. You have to be very clear about the answers you're giving, okay? We have not removed the womb is inside, and it has been repaired properly. So she'll ask you, so can I have babies in future? Yes, Mrs. Smith, you can very well have the babies, but the delivery, for the delivery, we would advise you to book in the consultant-led unit or in the hospital, a tertiary hospital, where all the facilities of because sometimes it make the wall a little weaker. So we advise you to be in regular follow-up with the specialist. Yes. And regarding contraception also, you have to advise her that we advise you to use proper contraception, so that to avoid any unplanned pregnancy. And just talk about contraception also, like you have to guide her, do the safety netting as well. Okay, so we will follow you up after some time, and that will be mentioned in your discharge card, maybe after 4 weeks. And in the joint clinic with the bowel doctor with us, for your checkup. And we will be giving you antibiotics and some pain relief medicines once you will be discharged from here. And she will be asking you that, will that be safe for my baby? Yes, we'll give you breastfeeding, like safe medicines on which you can breastfeed the baby. And then you have to tell the woman that if there is any bleeding, foul smelling discharge, or any severe pain in your tummy, you feel dizzy, then you have to report back. And your stay will be a little longer than expected, because now a bigger procedure has been done. So we, we want you to be okay before we discharge you, so that you can go home and take care of your newborn as well. So uh, is there anything else I can help you with? Okay, then she'll say, no, I want to complain, or yeah, no. Then you can guide her further. Then, with us, there is an internal inquiry which will be happening. And then if there is an issue like why did not you use the ultrasound while performing the procedure or something like that, then you can say, usually not in all procedures we do that, but if it has been told to you, I will definitely look into the notes, and I'll ask the colleague and inform the inquiry team as well about the same. Yes. Okay. Anything else? So like that, you have to be neutral throughout the station. Like otherwise, if you'll defend yourself too much, the patient will be very angry. You just have to be unbiased, and you're not on this side, not on neither on this side nor on that side. So just be in between, and uh, go in a way that the patient is not much offended.